Good morning, ladies and gentlemen. It's my honor to welcome you for today's important session on cervical cancer, a disease that affects thousands of women in Uganda every year. And did you know that cervical cancer affects over 3,000 women every year in Uganda? It is the second most common cancer in Uganda. And sadly, more than 2,000 women die due to cervical cancer-related issues. These numbers remind us of the urgent need of awareness, prevention, and timely treatment. As we gather and listen in today, since it's a month of October, the Cancer Awareness Month, these discussion is not just about numbers or statistics, but we are addressing lives. We are talking to families and communities. As Dr. Abraham, the director of WHO, once said that health is a fundamental right and prevention is better than cure. This session is about empowering women, communities with the knowledge to prevent this unnecessary suffering due to cervical cancer. Again, since it's a Sunday, let me remind you of a quoting from Colossians 6, 9, and 20 that says, your body is a temple of God. So it is your responsibility to take care of this body. Therefore, by you turning in to this program today and listening in today, you're not only learning a few things about cervical cancer, but also you're going to learn how to take good care of your body, since it is a temple of the Lord. And to discuss this important session with me today, I'm joined by one of those people that I believe in, all the way from Lubaga Hospital, a midwife whose practice and training are centered around cancers. She has met lots of people who are diagnosed, who are testing, who are fearing to test, and families that have gone through the tragedy of losing people due to cancers. And she's going to share her knowledge. She's going to discuss. But also at the end of the session, she's going to give us a chance to ask in a few questions. So I want to welcome all of you that are here. If you're here for the very first time, again, you're welcome. Please subscribe to this page to make sure every Sunday you join us. And if you find this session very interesting, remember to share it with your family and friends, or with every woman above the age of 14, because me and you, we don't know who the next culprit or the next person to test positive is. Remember, early detection of these cancers is the only sure way of managing or of making sure that the planned treatment actually work. Yes, Barbara. Good morning.
Good morning, Richard. Hello, everyone.
Can you speak up a little bit louder? My audience, yes.
Hello, everyone. My name is Nakabito Barbara, and I'm a midwife. I'm happy to be here as I'm going to share about cancer screening.
Okay. Barbara.
Yes, Richard.
3,000 women every year test or are confirmed positive for cervical cancer. let's start there. Can you tell us about cervical cancer? What is cervical cancer? And what is a cervix anyway?
Okay. A cervix, this is the mouth of the womb or the mouth of the uterus, and this is where the baby passes as it comes out. So that is a cervix. And then cancer, as cancer, this is when the body cells grow abnormally. So cervical cancer is when the cells in the cervix grow abnormally. When the cells in the cervix grow abnormally, then someone there is said to be having cervical cancer. This cervical cancer is a deadly disease. Once it's confirmed, very few people cure from cervical cancer. Cervical cancer, what causes cervical cancer? Cervical cancer is caused by a virus known as the human papillomavirus. It is the one that causes cervical cancer. And then we have probably these that causes or the predisposing factors of cervical cancer. What predisposes someone to get cervical cancer?
Yes.
First of all, we have that HPV infection I've talked about.
Yes.
When someone is infected with that virus, the human papillomavirus, if not detected and treated early, it can go up to when it becomes into cervical cancer. And then another predisposing factor is early sex.
Okay.
These kids that have sex at an early age, before the age of 18 years, they're also prone to get cervical cancer. And then we have these people that do smoke. Smoking, by the way, causes most of the cancers, including cervical cancer.
Okay.
How does it cause? We know very well that in smoking there is what we call nicotine. When someone takes in nicotine, it destroys the body cells. And remember earlier on we talked about the body cells being destroyed, or when they grow abnormally, it turns into cancer. So when they're destroyed, then probably someone end up getting any cancer, or cervical cancer, or breast cancer, any cancer that you've ever heard about. And then having multiple sexual partners, not being unfaithful, like it can be a man or a woman. Outside there, having many sexual partners, it can predispose you to get cervical cancer. And then the weakened immune system. These people having the weakened immune system, they're also prone to get this HPV infection. Remember we said what causes cancer is HPV. So when someone is infected with HPV, they can get cervical cancer. The people with weakened immune system that I'm talking about, I'll give an example of the HIV positive people living with HIV. They're at a high risk of developing cervical cancer because their immune system cannot fight against some diseases. It is weakened. So they're prone or they're at a high risk of getting this cervical cancer.
Okay. Thank you so much. Thank you so much, Barbara, for taking us through the definition of number one, cervical cancer, how we see it, and actually how the probable risks. Because Miandi, you understand that there is no direct cause of these cancers, right? But you've said there are some predisposing factors that, like you've mentioned. Now, what are some of you've also explained let me start here. Um, what are some of the symptoms that a woman can see and they tell that most likely I am having, this could be cervical cancer. I need to go and check, or I need to seek medical advice. Please advise, I'm seeing so many people joining in here, advise them to watch on the YouTube, not here. They can, yes, let them use the YouTube link that I shared, not this one. I shared with you, yes. Thank you. Okay, Barbara.
So,
Yes,
first of all, for someone to see these symptoms, it
yes,
means it has gone too far to become
yes.
cancer. It is very rare for someone to notice these symptoms before coming the real cervical cancer.
Yes.
So when someone sees these following symptoms, it means that it is advanced or it has turned into cancer.
Yes.
First of all, someone may notice the abnormal bleeding. When someone is not in her menstruation periods, but there is this bleeding, for example, bleeding after sexual intercourse. When someone has sex, she ends up bleeding, and then bleeding when someone is not in her menstruation period, painful sex, like having pain when someone is in that act. Then you also have the abdominal pain, the lower abdominal pain. Someone can get the pelvic pains. Yeah, all those can be signs of cancer. It doesn't mean that when you get one sign, it automatically means that you have cancer. No, it's a combination of some of those. Yes.
Okay. So, so someone experiences those signs. Now, Barbara, can you tell us the relationship of cervical cancer and age? Because so many people watching this program, and tomorrow a 12-year is going to experience some of those pain. They are going to have maybe painful menstrual cycle, and then a 17, maybe a 20-year who's just gotten married may have a little bit of pain during sexual intercourse, and they start crying. Oh, I heard Musao say, when you have this pain or irregular period, then most likely you have cancer. Because the problem we have with cancer, the moment you tell someone that this could be cancer, then they forget all the other causes and they only take the word cancer. What's the relationship between cervical cancer and age? Which group is most likely or most affected?
Actually, everyone can get cervical cancer. Cervical cancer doesn't have age bracket. As I said earlier, anyone can be infected with this HPV. HPV, it is the virus I talked about that causes cancer. At any age, anyone can get cervical cancer. It doesn't have any specific age. Those people that there is a myth that say that old people end up getting cervical cancer, it's not like that. Cancer, we have the precancerous condition and then cancer. When we don't screen for cervical cancer, we shall not know that we have cervical cancer. So you may find that someone has never screened for cancer their entire life. If someone was infected with HPV, it will end up staying there for so many years. Remember, this HPV turns into cancer within 10 to 30 years of age. It can take as long as possible for it to turn into cancer. So if someone has not screened for cancer, they will not know that cancer is coming in, or I can get cancer at any time. So it is always good to screen. There is no specific age for cervical cancer. Anyone can get cervical cancer.
So, Barbara, you're now becoming scientific here. So it's like we are talking about cancer, We're also talking about HPV, which is a human papilloma virus. How do we acquire this HPV? Are we born with HPV? Do we get it from people? Because it's like your explanation is telling us that we get the cervical cancer from human papilloma virus. So can you explain to the listeners and people watching in, how do we get this HPV? Yes.
HPV is got through sexual intercourse or body contact. Yes, this is when we can get that virus, the human papilloma virus. It can be sexually transmitted. When someone sleeps with you and is infected with HPV, you can probably get it. And then HPV can be spread from one person to another, but then cancer cannot, which means someone can get the HPV infection, but then cancer cannot be transmitted from one person to another.
Okay, that is actually now confusing again. So cancer is the abnormal growth of cells, right?
Yes, please.
So what is the relationship between now HPV and cancer? Does having HPV increase your chances? Is it the direct cause? Like, what the relationship between now HPV and this cancer?
Okay, thank you so much for asking that question. Now, HPV, as we said, it is the virus that causes
Yes,
cancer. When someone is infected with this HPV, it will go direct to your cervix, and when
yes,
it reaches the cervix, it
yes.
destroys the cells in the cervix. Yes, when it destroys the cells in the cervix with time, if not detected and treated, it can turn into cancer. So that's
Okay,
how the HPV causes the cervical cancer. It
okay.
destroys the cells.
So HPV virus is one of the causes.
Yes, actually, it is
So,
the virus that causes.
okay. So can someone have cervical cancer minus having HPV?
Uh, yes, it
Okay,
is very possible.
okay.
Because I told you,
Hmm.
I haven't talked about it. This HPV, by the way, sometimes it heals on its own.
Okay.
Yeah, it can heal on its own, though we don't get 100% that it will heal.
Hmm.
So that's why we always tell people to screen. If it's found there, then it is treatable. We can treat HPV before turning into cancer.
Okay. Thank you so much. And again, people watching in, I can see Mr. Muyinga um, already sending in questions. We are going to respond to these questions as we go on. And if you're there and you're having questions, please, this is an opportunity. Most of the time, we don't have consultation fee. So to consult, so that's why this page brings you these experts on live via such that it's like you're visiting your doctor. So put your questions in the comment section. And again, if you're here for the very first time, please subscribe and share this discussion with any lady or any female in your life, because me and you do not know who the next culprit of cervical cancer is going to be. Barbara, you're here discussing cervical cancer to us, and this is an area where you serve the population of Uganda in Lubaga Hospital here in every day. Why is cervical cancer a big concern in Uganda? How dangerous is it when a woman gets cervical cancer? How does that affect their life every day?
Actually, cervical cancer is very dangerous in Uganda just because our people do not screen.
Okay,
They do not screen. They always go to the health facilities when the condition has worsened. So
okay,
that's why it is now. That's what the Ministry of Health is now trying to fight by
okay.
by emphasizing the screening They always say early detection can always help us to treat this.
Okay.
So this cervical cancer, as I said, it is a deadly disease.
Okay.
When someone gets it and you don't get the medical attention, we have stages of cancer whereby some stages cannot be cured or cannot be treated. Someone cannot be treated. So that's why we always tell people to screen. Early detection helps you to get better treatment.
Okay. So, Barbara, uh, a person X has seen 2 or 3 of those signs and symptoms. They come to you, or they go to a health facility. What happens from there?
Actually,
How do we handle the patient from there?
when someone comes complaining of symptoms of such symptoms, first of all, we have the screening tests that we do. Yes, I'll first take the histories and so on, the family histories and so on, and then I do the screening tests. We have different tests of cervical cancer screening. We have the whereby you can test that HPV, that very virus I talked about, the human papilloma virus. We have a screening test whereby you can use it is called visual inspection using acetic acid. This test here, we put a certain acid on the cervix and then we observe the abnormal changes. The abnormal changes on the cervix. And then we have the pap smear, whereby we are going to take a smear from your cervix. We take it for microscopic findings. And then we have now this screening test of taking off biopsy. It is done to someone that is suspected with having cancer. When we see you and we look at your cervix and it is suspected of being being infected already, we shall take off a biopsy and then we take it for histology. Those are the screening tests that we have right now. And then we still, sorry about it, we have the endometrial sampling. This uterus, inside it has parts. So when someone has bleeding from the uterus, it means the problem now is in the uterus. This is where we need to check. You can look at the cervix and it looks very normal, but the bleeding is coming right away from the uterus. So here we shall take off the endometrial sample to test whether there is a cancer in the uterus or not. So those are the screening tests that we use to screen for cancer.
Barbara, from your experience, when do most of the women present themselves for this screening? Like at what stage?
Actually, so many people think that old people or people above 40, they're the one that are supposed to screen for cancer screening. So you may find most of the women that come to you are in that age bracket, 40 to 60. Yeah.
Okay. It is a very interesting discussion because being in healthcare, I've seen a lot of women actually when I'm an imaging expert or scientist. So normally when women come for different investigation, ultrasound, and I mean you see some things like masses in the cervix, and you're telling them to maybe go for these pap smear. They always don't want. They feel it's an embarrassment for them. They always don't want. But we are going to come back to that. Let's talk about myth and misconception. Now, there are a lot of myths around cervical cancer in our communities. What are the most common misconceptions that you encounter with your patients?
The most misconception is people thinking that it's old people who can get cervical cancer. It is the most. Actually, since I'm here today, I want everyone to know this. Cervical cancer is not for old people. It's not for old people. As I said earlier, anyone can get cervical cancer. So let's stop thinking that only old people can get cervical cancer. No. When we know this, we shall end up all fighting cervical cancer. Please, it's not old people. And most people think that when, let's say, when they take off that biopsy or when they do those cancer screening tests, they're probably going to make that person get cancer in a few years. Like always people say, nze wonna agenda ne bankebera ebyo bakozesa bireeta cancer. That's not true. A treatment gye bawa yegenda okuleeta cancer. That's not true. Yes, those are the most.
Yeah, because I mean, there are a lot of stories. I remember I come from Mukono, Nachisunga. I love that village so much. A place is called Ikatente. But sometimes when you go there for health education and you tell people, oh, maybe sometimes you need to have a biopsy, they say, okujjako akanyama kyekireeta cancer. Nti kasaba kujjako akanyama we but there is, in fact, someone telling nti baatugamba the moment they take off that tissue, nti cancer ngadduka misinde nga spreading very fast. We are here to clear those misconceptions. This is October. It is a month of cancer awareness. And we are going, for the next 4 weeks, we are going to talk about different types of cancers in both women and men. So whoever is listening in today, let us unlearn to learn. Let us learn to unlearn, or let us unlearn and learn. It is not true that weba kujjako akanyama cancer ng'ofuna cancer. No. It is not nti bagenda kujjako ekifi ky'ennyama kinene. No, it is a very small tissue. Akanyama ke bakujjako kenkananga omumwa gw'empiso, oba even smaller. In fact, in other countries, the moment you clock 25, you're required to test for cervical cancer at least once every 2 years. And if you refuse that, then no insurance company is ever going to take you on for insurance. It is as serious as that. Unfortunately, in Uganda, and I think as Barbara is going to share, most of you people will detect these cancers in the last stage. This takes me to the next question, Barbara. You talked about stages. You said when a woman comes with these symptoms, we are going to do certain laboratory investigation. Some are done in your nursing room, some are done in laboratory, other than done in the radiology room, like the biopsy by radiologists or pathologists. And you said that people that go for biopsy, can you differentiate between a pap smear and a biopsy for my sister down in Ikatente to understand the two? Kubanga abantu bagamba bera babita kujjako bunyama. What's a pap smear? What's a biopsy? And who goes for biopsy?
Thank you so much for that question. Actually, pap smear si kujjako kanyama. As you hear it, it is a smear. They talk of that there is a certain brush they use on the cervix, to take off a sample. It is like taking off a liquid, something like a liquid. It is not taking off sikujako kanyama. Biopsies, we are getting how can I call it? Biopsy, we are getting something small. Or I can't call it a body part, but something small from either your cervix, yes. But then pap smear, we just smearing. Yes.
In other words, tufuna ka brush nituyisako bwe tuti.
Yes, it's
So
what they take.
we take the brush for testing now.
Yes.
Or we observe the cervix.
No, we take the brush. Observing the cervix, it is the visual inspection. You're going to observe it with your own eyes.
Okay.
Yes.
Okay. More questions are coming in. Thank you much, Solome, for that question. We shall be coming to that. So we've done the testing. Results are back. Maybe let's say someone is positive for cervical cancer. What are the stages of cervical cancer that we have, and which one is the most dangerous?
Thank you so much. Stages of cervical cancer, we have stage 1, 2, 3, and 4. Stage 1, this one is it can be treated. Someone can be treated. It depends on the invasiveness of the cancer. But the worst stages, these are stages 3 and 4, when already the cancer has spread to other body organs. This one is really hard, and I can't promise someone that can be treated. But first stage, okay, we have first stage, and then what we call the precancerous conditions. When someone is having the precancerous condition, this one means someone has signs, has this HPV. When you look at the cervix, there is what we call the acetal white lesions. The cervix looks abnormal. So this one is called the precancerous condition, and this one is treated. We treat you there and then, the precancerous conditions. And then these stages, the stage 1, someone can also be, it can also be cured, but the stages 3 and 4, when the cancer has already spread to other body organs, I can't promise someone that can be treated. So that's why we always advise to come for screening. When you know something earlier, then there we can do something. Yeah, screening is always, early detection is always the best thing before it invades other body organs.
Yes, Barbara, you've talked about screening. This brings me to a question that normally my neighbors ask me. Is cancer curable, treatable?
Yes, depending on the stage.
Okay. So everyone listening in, cancer is curable depending on the stage. And actually, this is why we wake up every Sunday to come here and teach you about these diseases, because now it means that the primary responsibility is yours to check. It means the more you check, the more often you check, the more the chances that they are going to get this cancer at early stages. And Musao is here confirming that indeed cancer is curable in early stages. So, some people believe that cervical cancer only affects certain women. And I remember when my mom died in 1994, there was a rumor that she died of cervical cancer. And I remember there is, I think there is another person that they were not in a good relation with. I was young, but I remember some people are saying, or telling me clearly, Mama oba amuloga cancer wa nabana. And actually, it's one factor why I became a medical personnel, because I always wanted to find out what exactly killed my mom and what exactly killed my dad in terms of medical, because those words, the two of them died 4 months after the other. And so those words still reign. How can we address such harmful beliefs? Because now I understand that indeed no one can bewitch another person of cervical cancer. Barbara, how are you addressing that at Lubaga Hospital? If I bring my wife and my wife is clear, sure, ntonalabika inayo kaside dish ke kati kandoze cervical cancer. How do you address such?
Actually, in cervical cancer screening, we always, first of all, we teach people or we health educate people. Health education is the first thing because you need to first know what cervical cancer is. Trust me, when someone gets to know what cervical cancer is, they'll probably not believe that they are bewitched. That is because people are not informed. They don't know what cervical cancer is. But when you health educate someone and she gets to know what cervical cancer really is, that belief won't be there anymore.
Okay, so health education.
Yeah.
Okay, so we've moved from signs and symptoms. You've told us about HPV and the relations. You've moved to testing. We've confirmed someone maybe has cervical cancer. Let's look at management. So then, I have a person is tested positive. So what happens from there? Do I go back home? Do I go and start crying? What happens?
Okay. Actually, management, as I said, it depends on the stage and it depends on the condition because you have these precancerous conditions. Those ones are managed by, we have what we call thermocoagulation. Thermocoagulation here, we use heat to kill to destroy those cells, the precancerous cells or the HPVs. If you've done the visual inspection and you've observed something not normal on the cervix, there is that part with a settle white lesion. We treat that part, and the management you can use the thermocoagulation. Thermocoagulation, we use heat to destroy those cells or that part that you've observed, it is not normal, the cervix. And then we have the loop electrosurgical excision procedure, what we call the LEEP. Here we there is a we cut off that part that is affected on the cervix. We cut off something small, yeah, and then we have the cold knife, but this one is rarely done. Here we use the cold temperatures to kill off those cells. So that management I've talked about is the management of the precancerous condition. When you've detected something on your cervix that looks to be something else that will cause cervical cancer, or you've detected HPV, those are the treatments we can use, the management you can use. And by the way, it cures those management that I've talked about. And then when someone is confirmed having cervical cancer, as I said, it depends on the stages. The management, we have surgery, also depends on the stage, whereby they can't do anything but to remove either the uterus to prevent that cancer to invade to other body organs. If it is only on the cervix or in the uterus, they will remove the uterus. So that is surgery to prevent it invading other body organs. And then we have what we call radiotherapy. Radiotherapy, it also depends on the stage. Here they use the radiations to kill off those abnormal cells, those abnormal cancer cells. They can use radiation in combination with chemotherapy. Chemotherapy, here we use the chemicals, the drugs. Yes.
Okay. Is the I used to work with one of the centers and and also one of the those are private organizations funded by then were funded by USAID and other partners, and they used to give us something called something called cryotherapy, where they say they would put an ice there. Is that method still used?
Yes, please. Sorry, I'd
Okay.
forgotten about it.
Okay. So I think to everyone viewing in, our viewers are sending in very important questions, very interacting question. It means they're actually watching. And again, if you're here and you've not subscribed, please subscribe and remember to share this video with someone. There is a time we're discussing about sickle cell here, and I shared this video in a wedding group by mistake. And actually, I put it at night, and then I was supposed to delete it in the morning. And in the morning, the person who was actually supposed to marry writes me Nangamba. He says, "Doctor, I think you are God sent." When accidentally I opened that video, I realized that I had not asked my partner about sickle cell. Now, when I asked, I realized that both of us were carriers. So they had to postpone the wedding to sort that. I won't discuss the results because they were not good of the discussion. But both parties, both the girl and the boy, were actually happy that I accidentally shared that. Now, you don't know who benefits from this information. You could be having a woman a lady or a girl that is bleeding, and she's thinking she's having maybe hormonal imbalance, that most of the women, each time we see irregular bleeding, she'll have pain, we are quick to judge. Maybe they are using emergency pills. No. Someone could be showing early signs of cervical cancer. So to men that are watching, in my fellow men, when your woman experiences chronic lower abdominal pain, when during sexual intercourse she's telling you she's having excessive pain, please don't say, oh, they always say that during this type of action. If she says she's feeling uncomfortable, she's experiencing excessive pain, that especially she has not been experiencing before, she's having longer periods or something, it could be that she's showing early signs of cervical cancer. So before we move to the next topic of our discussion, we want to look at actually screening and early detection in detail. Early detection is often mentioned as the key, and I've not gone to any cancer session, and I fail to hear you people emphasize early detection. Can you explain the difference between? You've also explained the different screening methods available in Uganda. My question is, who should be screened?
Thank you so much. All women in reproductive age are supposed to screen for cervical cancer. All women that engage in sexual intercourse are supposed to screen for cervical cancer.
Okay. Because when you say reproductive age, someone is going to tell me which age is that. But when you say all women that are engaged in sexual activity, it means if you're 13-year-old, but you're doing what adults are supposed to do, it means you qualify for this. And let me ask, where are these tests done? Do I need to go to Uganda Cancer Institute? Do I need to go to Mulago? Do I need to come to Lubaga? Which facility levels can we access these services? And who does it exactly? Do I go to scan? Do I go to nursing section? Do I go to antenatal? Where should a person watching this program and they are scared or they feel they need to go for cervical cancer screening, where should they go?
Thank you so much. Actually, cervical cancer screening is done in most of the health facilities, most of the hospitals. Since they found that cervical cancer screening is the most cervical cancer is the most cause of death of women in Uganda. So they made sure that it is in every health facility. So you can find it in Ruwaga, we are always there. You can find it in Nsambya, Kawempe, Mulago, everywhere. Most of the health facilities, there is cancer screening. And when you go there, you may not know exactly which person to see.
Yes.
But when you request that you want to know more about cervical cancer screening, or you want to do that cervical cancer screening, they always tell you the exact person to go to. If you need to see a doctor first, then a doctor will request for these tests. You can see the doctor as well,
Um,
or the gynecologists. Yeah, it depends.
okay. Now, since I'm having a person from Lubaga, if I want to send someone to Lubaga, where should they go? Who should they see? How much should they move? Which days should they come?
Thank you so much. At Rubaga, we're always there from Monday to Friday, the cervical cancer screening clinic. Actually, when you come, you reach we have the reception point, and then you tell them that you've specifically come for cervical cancer screening. They'll direct you. They bring you direct to my room, the cervical cancer screening room, and then we shall first discuss before you pay for anything, because we have different tests, and then the payments also vary. Yeah, and then after that discussion, then they will tell you, if we need to do this test, you're going to pay this amount. If we need to do this, and then you're going to pay this amount. Or if you need some time to still, because you can come, you need to screen for cervical cancer, but then you're in your menstruation periods. That you cannot do it. Yeah, we shall tell you to first go complete your periods, and then you come back.
Okay.
Yes.
Barbara, so many women fear embarrassment, and sometimes the costs prevent them from going for these screenings. For government facilities, they always fear breaking the information for them. What advice do you have for these women? Number one, a woman that maybe has money to come, but they fear to get the result. Number two, for a woman who is my home village Katente, Mukono, who does not have money to come for these tests, but they have seen the message and heard. Maybe they have not seen any symptom, but they wish to know. And then there is one who just fears embarrassment. What if I go there and I find a Mero Musau is the one to do this pap smear? What advice do you have for those three women?
Actually, for someone who fears for the embarrassment, I'll advise them not to. Because when you're okay, we have choices whereby someone can say, I want to be worked on by a male doctor or a female doctor. But when you're a patient, it's always good, okay, to choose wisely. And fearing wouldn't be a good option. Because you've come to the hospital, you want to know exactly what's wrong with you. When you fear, which means you also be fearing to get the results, which is not good. Please, I'll advise everyone not to fear the results, because it's always good to know. Yeah, when you know, then you know what to do next. So it's always good to know. Do not fear. And then for someone who doesn't have money, we have health facilities that do provide cervical cancer screening at a free cost. We have Kawempe. By the way, Kawempe, they do provide very good cancer screenings, and other health facilities. The government health facilities, they do provide good cancer screening services. So you should reach out to them, please.
Okay. What about those women who fear just to get the results? What if they tell me I'm positive?
Now, about fearing the results. As I told you, first of all, by the way, in cancer screening, we do counseling. Yeah, we do counseling. There is what we call the pre-counseling and the post-counseling. Pre-counseling, we always give it before doing any test. Yeah, we talk to you what is expected and what we do after maybe the results were out, what we should expect. So we always prepare your mind. Yeah, trust me, when you come to us, there won't be a fear, because we shall tell you what is expected and what we are going to do after when the results are back. So we always clear that before doing the screening.
Okay. So, Barbara, as we are about to finish up our discussion today, someone has sent in just a clarity. We often hear about HPV vaccine. You talked
Yes.
about HPV. So we've always talked about, heard about this HPV vaccine for young girls. And some of us have hidden our daughters. No, mwagala bakuba ddagala ly'abazungu and so on. Bamama baffe, tebali bagema, lwaki bagema abaana baffe. I mean, some parents are hiding their young girls. Not because they don't want to, not because they want them to get cervical cancer, but because they fear, because there are so many now immunizations happening. Now, to our mothers, these things, they were never immunized against such. Can you explain the importance of this HPV vaccination in young girls? And then, what age is recommended for this vaccination?
Thank you so much for this question. The age that is recommended is 10 to 14 years, recommended for HPV vaccination. When someone is vaccinated against the human papillomavirus, this person is protected against that virus. Yeah, the chances of getting this virus will be reduced when someone is vaccinated. So I call upon all mothers and fathers to always take their girls for vaccination. It helps them. Yeah.
You said it is recommended for girls between 20 to 15 years. Why?
Probably this age group, we assume that they've not engaged in sexual intercourse yet.
Okay.
Yes, some girls get their periods a bit earlier. Some may get periods on uh, when they're 9 years old, when they're 10 years old. So that's why I always tell that age bracket. Also, anyone who is above that can get HPV vaccination, but I cannot assure you because you're already exposed. Yeah, so the chances they're low.
Okay. Okay. So does that mean if a young lady has already had sexual intercourse, it is useless for them to be vaccinated?
Yeah, the chances are low, they're reduced.
Okay. This now. So then, what's the role of men in the transfer of this HPV vaccine?
The
Because I remember also when you're starting, you talked about having multiple partners or sexual. So what's the role of men in transferring this HPV virus?
Actually, this the human papillomavirus, it doesn't affect men, but they can transfer it from this woman to this woman. For
Oh,
them, it doesn't affect them. Yeah,
more reason why being a man is,
it is good. It is
yeah,
not.
oba olonze kyapa mu mannya go.
Mm.
Okay. Okay. So, Barbara, are there some misconceptions that the public has about this vaccine, or something that we should be aware of?
Actually, I think it is on all vaccines. This
Okay.
misconception is on all vaccines, whereby people think if they get a vaccine, they'll probably get that disease. That when I get when I bring my girl for HPV, what if she ends up getting that cancer? That is not true. People think that when you get the vaccine, you'll probably get a disease. That's not true.
Okay. Okay. Lastly, let's look at community and family support. Men and family always play a big role in women's health. Sometimes the opposite is not true. Not so many women are involved in men's health, but men are playing a big role. Responsible men are playing a big role in women's
Yeah,
health.
yeah,
So how
you're right.
can partners, parents, communities support women in preventing and detecting cervical cancer at early stages?
Thank you so much. As communities, now this message goes to my people here. As you go back to your communities, kindly make them aware. Give them the same information that you've understood here. If you make them aware, you'll be helping them. Someone who hasn't thought about going for screening, they end up thinking about it. Yeah, so always spread the information. Talk to your sisters, talk to your wives, talk to your mothers, talk to your grandmothers to always go for cancer screening.
Um, Maybe she's speaking with a soft tone, but I want to remind everyone watching in that we are talking about 3,000 women who are detected with cancer, cervical cancer every year. We are talking about 2,000 women who are dying from cervical cancer and related issues. But let me ask you a question. In 2025, why should we continue having our sisters, daughters, wives, mothers die of a disease which, when treated early enough, can be prevented or can be treated? This is what actually causes me the pain. This is what bothers my heart to continue looking for people like Barbara to come here and give us more information. It is a shame that even the learned friends that know this information, that hear this information, that see this information, the ladies working in offices, big, big offices, small and big, even some healthcare workers that are female, up to now, you've never screened for cervical cancer. And tomorrow, when it is stated in late stages, then we are organizing a car wash for Maureen, for Deborah, or for Sarah. Why? Because instead of going for early screening, twagendanga ku beach, twali tulumya bayaaye, and so on. To every woman listening in, if you cannot have money to do this cervical screening, look for a government facility where these services are free. And at least make sure every 2 years you get just a checkup. I'm telling you, that could be the difference between you detecting the disease early and you reporting in the third stage. Barbara made it clear that if you come in third or fourth stage, literally what we are going to do is called palliative care. We confirm, yes, you have the disease. We confirm, yes, you have the cancer. There is nothing we can do, but we don't want you to die in maybe a miserable or a terrible state. So whatever we do is to just make sure we keep you in peace as we wait for your time. Now, that is very miserable, and no health worker wants to pass that information to any patient. Please, my sisters, mothers, friends, daughters listening in, If you have a child that is 10 years to 15, or that is non-sexually active, maybe she's 16, but she's non-sexually active. Maybe you just had the information today. She's already 16 years, but take her for HPV vaccination. Because that could be the difference. Because if we were, imagine if all our parents, if all of our generation were immunized at age 10, it means that maybe now we'll not be having anyone having cervical cancer. It means that even the men, because we want to blame the men for transferring, but if they are sleeping with women who don't have this HPV virus, then it means maybe they will not take it anywhere because they are not picking it from anywhere. So the responsibility is mine and you to make sure that we all do our part. And we've done our part. We woke up this morning, prepared this presentation to make sure we give you this information. Lastly, Barbara, when there was that HPV vaccination, schools, especially private or international school, locked up their gates and they were chasing these people who are supposed to immunize these people. They'd never allowed them to get into these schools because the parents refused, or the schools felt they did not understand the message well. So what role do schools, health centers, and the policymakers play in the prevention and treatment of cervical cancer?
Thank you so much. Actually, we always involve this all these people. We always involve schools. We always go to schools. We spread the message and make everyone know about cervical cancer. We let teachers understand what cervical cancer is and how to prevent it. By the way, I didn't talk about this, but the only two ways to prevent cervical cancer is by vaccination and by doing the routine screening. Those are the only ways we can prevent cervical cancer. Please let everyone know this. Routine screening is so helpful in preventing cervical cancer. So these teachers, once they understand what cervical cancer is, they can probably allow or transfer the messages to parents, as we also do a continuous health education to the internet, radios, and so on, so that these parents get to know the information about cervical cancer screening.
Barbara,
Yes,
do you
please.
think we've done enough to inform the public about cervical cancer?
We are still doing it. This is not something that you can stop doing, because cervical cancer is still a big problem to us. So we are still doing it. We haven't done enough. Yeah, we are still doing it, and we believe if these people get to know what cervical cancer really is, we shall probably end cervical cancer in Uganda.
Okay, and now we are going to go into a few questions that we've received, but this question goes to the viewers, and we want to see your answers in the comment section. For viewers listening in today, what practical steps have you had from this discussion? And what are you planning to do immediately from here to make sure you join forces in the fight against cervical cancer? Number one, are you going to go for testing or screening immediately? Are you going to get involved in preaching or teaching other women about this? Are you going to share this video? Or you're not concerned about anything? We want to know and hear your opinion from in the comment section. So, Barbara, we shall very first go through these questions, and after that we shall call it a day. The first question is coming from Mr. Dash Muyinga. Dash, thank you so much for watching in today and for keeping it up to this time. He's saying, thank you, Musao, for this information you have shared with us. But my question is, if my wife has these viruses, does it mean she has cancer?
Thank you so much, Mr. Minga. Now, as I said before, HPV or the human papillomavirus, when it reaches the cervix or when someone has tested HPV positive, it doesn't mean that this person has cancer. No,
Yes.
it doesn't mean that. HPV is a precancerous condition. As I said earlier, HPV, when it goes to the cervix, it destroys the cells. So when someone gets HPV and we do not detect that early, it can turn into cancer within 10 to 30 years. When it stays there, remember it is destroying the cells. So the more it is destroying the cells, the more the cells become abnormal. Hence someone getting cervical cancer. So HPV doesn't mean that someone has cancer, but has a precancerous condition.
Okay, thank you so much. I think, Mr. Dash, your question is answered. Again, others, you can put your questions in the comment section, but as well, you can respond to our question. Our question to the public was, what are you willing to do as you, the person that was watching this, to make sure you join the fight against cervical cancer? Since it is October and it is a cancer awareness month. The next question again is from Dash, is saying, how long does it take to manifest after acquiring the virus?
That is 10 to 30 years.
Okay.
It can take that long, yeah, for it to become into cancer.
Okay. This one is coming in from Nakato Solme. She's saying, thank you so much, Barbara, for teaching. If I'm not sexually active, I hope you're not talking about yourself, but if you're talking about yourself, if I'm not sexually active, can I get cervical cancer?
Does she mean that the entire life she has never been involved in this?
Ngam sister.
Actually, HPV, as we said, it is sexually transmitted.
Yes.
So when I'm a lady and I have HPV, we have in Uganda we always use the second hand clothes. Always buy them. So you never know by any means if you buy a second hand panty, a second there is a possibility of you being infected with HPV if that person that wore it had the HPV infection. So I cannot tell you that you will not get cancer. What I can advise is please screen for cervical cancer as much as possible.
You've mentioned something about second-hand panties. I didn't know in 2025 it still exists.
Yeah,
But
it does.
if we can avoid, please avoid second-hand clothes, especially inner clothes. But also to re-echo what you're saying, Solomon, HPV is one of the causes. But like she said in the beginning, that when the cells in the cervix start to misbehave or to lose control or to start growing in a way that is abnormal, and this growth can be triggered by so many things. HPV is one of them. But it can also be to exposure to high-level radiations. That's why sometimes we don't want to expose ladies in their reproductive age to high radiation in X-rays, or unless you really need it, because sometimes the interaction of these cells with these high energy radiations can cause them to become abnormal, to start misbehaving, because cancer is just the abnormal growth and enlargement of these cells. So anything that causes, there is also some science that says continuous things like continuous abortions, things like continuous chronic infection that continue causes scarring on your cervix, one scar after the other, sometimes could change the nature of those cells and change them into a malignant something. So yes, even when you're not sexually active, you can get cervical cancer due to other non-HPV related. That is my understanding. So, like she said, two things: vaccination, because she said you can also have HPV from used panties. Number two, early screening. Can you imagine we are dying because of these two simple things that we can't do? And next question is, Dash is very interested. Dash, your girlfriend should be very happy, and because I mean, if every man had a responsible man that attends to cervical cancer and asks kind of question, I mean, it shows the inclusivity or the role of men actually that we talked about. He said, is this screening painful? If yes, is it
No,
bearable?
it is not painful.
Barbara,
Mr. Minga,
have you ever done it?
because I always do it. Yes, I
Okay,
myself I do the screening. It is not
okay,
painful.
okay.
Yeah, it is not. It's something. Remember, to do this screening, we ladies we have to put something down that help us to visualize the cervix very well.
Mm.
So when there is something inside, you can feel uncomfortable. There is a little bit of uncomfortability, but not painful. Yeah, it
Okay.
is not painful.
Okay. The other question is okay, that is done. How long does this screening take?
Um, for the screening, HIV negative people, we are supposed to rescreen every after 5 years. And then
Okay.
HIV positive people, we are supposed to rescreen every after 3 years. Why? Because as the we people living with HIV, our immunity is weakened. We are immune compromised.
Mm.
So that's why our screening is a bit different from these that are HIV negative. So you're screening every after 5 years and 3 years.
Okay. This one is saying how many times should one screen? I think you've answered that. You said
Yes,
HIV negative people once in 5 years. Yes. And then HIV positive people once in
in 3 years.
3 years. Okay, this is Jacqueline Munyango saying people have a lot of myth out there, but thanks, Barbara. Uh, okay, Solomon is saying what she's going to do after here is sharing the video and advising my partner to have me only.
Thank you so much, Solomon.
Sajja nga yeesiimye oyo.
That's good.
Then lastly, that she's saying after screening and treatment, how long does it take for one to engage in sex? And do we have treatment for men? Actually, that's what I was going to ask. Thank you so much for that. So after treatment, let's talk about sexual intercourse. After, if, for example, I come for this screening and you tell me, oh, we've done a pap smear or we've done whatever simple test you've done, or even I've been confirmed with cervical cancer, do I abstain now from my partner? Because for HIV they say use condoms or something like that. What happens here? Because abantu baagala okwegatta.
Yeah, true. Actually, you cannot deny someone from having sex. We always advise men to come with their wives as they're coming for screening, because we need to health educate them. If we health educate these two people, we tell them the causes, the predisposing factors. Trust me, if you talk about getting or being predisposed to cervical cancer, is through having these multiple sexual partners when the man is there. Also, the man will be cautious and be like, "Oh, I need to stop this. I need to do this." So we always advise them to come together. When you health educate them together, it was helpful to both the man and the woman to prevent cervical cancer.
Okay. So because actually he's asked a very good question. I wanted to ask, if men are responsible for transferring this virus, can we check it in men? Like, can we screen it in men and we treat them?
No. Actually, in men,
Yes,
this virus, for them, their role is to transfer it. As I said, it doesn't affect them.
yes.
So for the men, HPV doesn't affect them. They just transfer it for us, to us women. Yeah. Yeah,
Okay,
for the men, they are not affected.
again, if you're here and you've not subscribed, please don't leave before subscribing. Lastly, Barbara, cervical cancer versus pregnancy or fertility. If one is detected with cervical cancer, does that affect their fertility? Does that affect if I come and I'm pregnant and they do that test and whatever? Can I carry my baby to term?
You mean if they do the test and it turns out
Yeah.
that
For
you have
example, it's antenatal, they are checking totally different things, but then they find I'm pregnant, but also maybe positive to one of the cervical cancer tests. What happens then?
if you're positive for cervical cancer, let's say the precancerous conditions. If it is the precancerous condition, we don't, we we allow you to carry the pregnancy up to term. Then when you deliver and the baby is 4 to 3 months, then there we can treat the precancerous lesion. We cannot treat someone who is pregnant. We allow you to carry the pregnant up to term and then you deliver. And also, cervical cancer, how does it affect the fertility? Uh, it depends on the stage, as I said. Trust me, when someone has cancer that has already invaded the whole uterus and so on, we may end up removing the uterus. So it means someone cannot give birth after removing the uterus. So it depends on the stage.
Okay. And lastly, cervical cancer and HIV. What the relationship between if someone has HIV and another person has cervical cancer? What is the relationship between cervical cancer and HIV?
Cervical cancer and HIV, remember this person is already immunocompromised.
Mm,
So when someone gets cancer, is so much affected to someone compared to someone who is HIV negative.
mm,
This someone will end up being exposed to so many various diseases or infections. For example, this someone may end up getting the diabetes and so those other diseases because now that the immune system is going to be very weak. So that
mm.
person is too much affected compared to someone who is HIV negative, being the fact
Oh,
that is immune compromised.
okay, Shamim Namaganda is saying, thank you so much, Senior Barbara and the colleague, for this information. Is clear and easy to understand. Thank you so much, Shamim, for listening in and watching in. And then Maureen Nakanoni, one of our very common listeners, saying, but you men, stop jumping from one woman to another. I think men you've had. I'm not one of the jumping men. So
Then that's good.
those men that jump from one woman to another, I think you've had. Again, I really want to pass on this note to thank Lubaga Hospital in a special way for always allowing your staff to come on this program. I can attest that I think 60% of people that have hosted here are coming from Lubaga Hospital. And I don't take that lightly. I really want to thank the management and the staff of Lubaga Hospital. I always tell my fellow health professionals that it's not enough that we stay in hospitals to wait for people to fall sick. It is very important that we teach people about disease such that we can prevent more people from falling sick. Because however much we are good, we cannot treat everyone when everyone falls sick. So in a special way, thank you so much, the management of Rubaga Hospital, but also wake up call to other hospitals in Uganda. Please, this platform is open. This youth page is open. And every week we speak to close to 2,000 plus people about various diseases. Please allow your staffs to come in. And if you have information, medical information, urgent and not urgent, to pass to the public about the services that you're offering in your health facility, please write to the email is passing. It's a consult, Mr.Selfcare@gmail.com. But also if you want to consult something from Musao Barbara privately, please write to consult Mr.Selfcare@gmail.com and I'll pass your information to her. Unless it is okay for her to share contacts, but because of people that used to disturb my guests, I stopped that, because you would call them. Someone is teaching about cervical cancer, you call them to ask them about someone that came here and talked about manpower, because you watch the two videos together. So, Barbara, what are your closing remarks about cervical cancer now that we are in the month of October, where we are talking about awareness of different cancers?
I'll advise everyone, all women out there, all husbands out there, please advise your women. Please come with them, bring them to screen for cancer. It is always good, as the saying goes. Prevention is better than cure. So please bring them, come for cancer screening. Come to Rubaga for cancer screening. We have experts. We have all services. And by the way, you're not expensive. Yeah, so please always come for cancer screening.
Barbara, is there someone you want to send regards or greetings to?
Not really. I send greetings to everyone watching in today. Thank you so much. And thank you so much, Mr. For hosting me here today. I'm humbled.
Again, it is always my humble request to everyone watching, and please subscribe to make sure you don't miss anything. We are here every Sunday, and this whole month we are dedicating it to cervical to cancers. We are going to talk about breast cancer, prostate cancer, and other types of cancers. Please, if you're there and you're an expert that would love to add knowledge, join Barbara in this whole month as we continue to explore different cancers every month. My role and Barbara is to inform, to tell you about things that we think you didn't know. Your role is to do. One author said it's not important to know and not to do. It will be really useless for us to come here, we tell you the information, and you do nothing about it. To every woman listening in, screening, if you're already sexually active, is the only way between you and cervical cancer. In summary, Musao Barbara has emphasized that if we detected in early stages, it is treatable, manageable, and curable. But if it comes in late stages, we only have palliative care. Methods that will only treat maybe the current cancer, but maybe you're going to have another one 5 years later. In other words, we are just buying some years for you. But early detection, you can have complete healing. Ladies and gentlemen, my birthday was yesterday, the 3rd, and for everyone that sent in greeting, thank you so much. But my gift for the entire world listening in, especially Uganda, where I come from, is that these diseases are curable, manageable. So my birthday gift to you, ladies, is the video or the topic that we've had today. Thank you so much for blessing me, for helping me, for praying for me, for standing with me in hard times, and for subscribing to this page. Ever since we started 4 years back, we are growing in numbers of subscribers, in watch time. Thank you so much. This information is really important for you, and that's why we come here every single morning. Ladies and gentlemen, as we come to the close of today's important session, I want to thank each of you for joining and for your commitment to learning about cervical cancer, a disease that is preventable, treatable, and yet still claims too many lives in Uganda. We've heard today from Barbara about the myth that surrounds cervical cancer, the importance of regular screening, and the life-saving role of HPV vaccine. Remember, knowledge alone is not enough. It's action that saves lives. Encourage your families, community, churches, friends to get screening, to support vaccination programs, and to speak openly to other women about women's health. As we live today, let us hold on to the words of God. And I want to close by reading for you Proverbs 4:7. It says, wisdom is the principal thing, therefore get wisdom. And with thy getting wisdom, then they get understanding. I believe Barbara shared her wisdom, expertise, and knowledge about cervical cancer. And you've understood. The only way to show that you've understood is when you go and screen or take your girls below 10 years, between 10 and 15 years for vaccination. Let us take this wisdom into our homes, workplaces, communities, spreading awareness and taking responsible stages to prevent cervical cancer. On behalf of this show, Mr. Selfcare, I extend heart thanks to Barbara Nakabito, our expert, and everyone who contributed in making this conversation meaningful. Together we can break the silence on cervical cancer. Together we can save lives. We can build health communities in Uganda. Thank you so much, everyone. Stay safe and remember to take action against cervical cancer. For God and my country, I love you all. Have yourself a blessed Sunday and bye.